This video will illustrate for you a step-by-step process about how to administer your enteral formula as a bolus through your tube using a syringe. Note, the products that are seen in this video may differ slightly in terms of color or size than what you receive at home. The feeding tube that you have may also differ from what you see in this video. Your clinician will demonstrate all of your supplies during your first few visits. If you ever have any questions regarding this video or your supplies, contact your pharmacy. The number is located in your patient packet that you received with your first delivery. Feeding tubes are used to allow you to get the nutrition you need from liquid, blenderized food, or formula directly into your stomach or intestine. Tubes will reach your stomach or intestine through your nasal passage or abdomen. The bolus or syringe method is used to give yourself a set amount of formula over a short amount of time through a syringe. Step 1. Gather your supplies. First, you will need to clean a surface with soap and water or disinfectant wipe. This is where you will place your supplies. Now, grab the syringe, formula as prescribed by your doctor, cup of room temperature water, and clean towel or paper towel and tube feeding guide. Do not warm your formula in the microwave. You should store your formula at room temperature. Look at the expiration date. Also, make sure that you are sitting upright or have your head elevated to a 30-degree angle or more if you are unable to sit upright during your feeding and for at least 30 minutes after your feeding. Step 2. Hand washing. You will not need to wear gloves for this procedure. You will wash your hands thoroughly for at least 20 seconds. Using soap and water or a disinfecting alcohol-based hand sanitizer if you do not have access to soap and water. When you finish washing your hands, you will dry them with either a paper towel or a clean hand towel that is used only for this one time. Use the towel to turn off the faucet. This is a clean procedure, not a sterile procedure, and should mimic what you would do before you sit down to eat dinner. Step 3. Flushing. Flushing is the #1 way to prevent your tube from clogging. It's important to flush before and after you put anything down your tube, which includes medications and formula to help keep your tube clean. Grab the cup full of room temperature water and syringe. Put the syringe in the water and pull back on the plunger to fill the syringe to the amount prescribed by your doctor. Usually this amount is between 30 to 120 milliliters, but call us to confirm the amount if you are unsure. After you have the syringe full with the prescribed amount of water, make sure to clamp your tube before you open the port. Once the port is open, hook the syringe up, unclamp the tube, and slowly push or flush the water through the tube. When you are finished flushing your tube, remove the syringe and close the port. Step 4. Administering your formula. Your formula should be at room temperature before used. First, shake the formula container well. Remove the formula container lid and plunger from the syringe. Don't forget to clamp your tube before accessing your port. Open the feeding tube port. Once again, connect the syringe to the port and unclamp the feeding tube. At this time, simply pour the formula into the syringe, using it like a funnel, and hold your tube upright as gravity takes the formula down through your tube to your stomach. If you'd like to speed up the flow, hold the syringe higher. To slow down the flow, hold the syringe lower. Another way to give a bolus of formula is by using the plunger and slowly pushing in the formula as you do with a water flush. This will allow you to have more control over how fast or slow formula goes through your tube. Most patients will speed up the rate or slow down the rate depending on how they feel during their feeding, but the average time recommended for a bolus syringe feeding is 15 to 20 minutes. Step 6, cleaning your equipment. You are able to reuse your syringe, just make sure to hand wash it with dish soap and warm water and air dry it on a clean towel or paper towel. Most patients are able to reuse their syringe for 1 to 2 weeks or until the rubber part of the plunger wears out. If there is unused formula left over, you may cover it and refrigerate it for up to 24 hours. Be sure to let the formula warm to room temperature before administering it in the future. Discard empty containers in the trash or recycling bin per directions on the container. Congratulations! You are now finished with your tube feeding using the Bolus syringe method. Emerita is available to help any time of day, any day of week. Do not hesitate to call your local Emerita pharmacy with questions or concerns. This contact information is in your folder. You will also find resources on our website available to you at www.emeritaiv.com. We look forward to the opportunity to serve you.